Welcome everyone to the Georgia One Health Consortium monthly meeting for February. I am Jessica Schwind from the Institute for Health Logistics and Analytics at Georgia Southern University. And, I'm kind of just the de facto cat herder, I guess, for this group. And so I always like to give a brief update of the group and the trajectory we're on. But I am so excited to announce today, as you can see on the screen, that we are up to 150 consortium members across the state of Georgia and beyond. And I say and beyond because just in hearing people like introduce themselves on the Circle account and just knowing people from throughout, I know we have Alabama representatives, South Carolina representatives, we have partners in Ireland, and then partners in Nigeria now. So it really is really cool to see the growth of this group and the enthusiasm that everybody brings to the table. And the second metric that I like to present is our Circle metrics. So Circle is our platform for engagement. And so there, you sign up to be a part of the consortium, and then we automatically send you an email that says, hey, if you want to engage outside of these monthly meetings, then, go and sign up for free on our Circle engagement platform. And so we are up to 57 on Circle, which is really great. And so just to tell you a little bit about the Circle platform, this is what it looks like. And this is where people can post stuff. So if your organization is maybe doing a drive or a webinar, or you have announcements, such as random as the Pope this past week endorsed the One Health approach. You can you can put it on this platform. It's just a way to keep everybody engaged. I have engagement with both national and international One Health organizations, and so I make sure that our Georgia Consortium members have that information as well, such as the One Health Commission is looking for board members. So this is the place to go. If you have a paper that was recently published on One Health and you want to share, or maybe you have opening for students, or maybe a faculty position open, or a staff position at your nonprofit, this is the place to go. And so if you need the sign up link, just drop me a message. And we'll get it to you, but I cannot encourage you enough to please engage with the Circle community. Also on our consortium website, we love to highlight consortium partners. So you can see all of the ones here that are currently on the website. And we, until we get it hosted externally from Georgia Southern, it's really important to me to make sure everybody knows this is an all-inclusive a group that encompasses governmental, non-governmental, private, nonprofit, all organizations. And so we're really diligent about uploading logos that you guys allow us to upload in order to show that. So please send us your logo and we will feature it on our website. And so we are still looking for one more volunteer position. We're calling it the Partnership and Collaboration Lead. Really, we're just trying to bring together a group of folks that can help advance the goals and objectives of the Georgia One Health Consortium. And we have a lot of wonderful volunteers already identified, and I'll be reaching out to them soon once we kind of get our final group. But there's no minimum or maximum time commitment. This is our first rodeo, so please just give what you can in terms of time, and we'll see where it will take us. So next steps, I always end with this, which is please encourage people to sign up to join the Georgia One Health Consortium. You can do this by sending people to this bit.ly link. I was so excited to see several students from Fort Valley State University have signed up since our last monthly meeting, as well as several professionals from the CDC. So that was really great to see. Once you sign up, do not forget about the Circle community. That's just one little extra step. so that you can really start to engage with folks. And then our next meeting is March 27th. We have an excellent speaker in mind and cannot wait until you hear from her. So again, I'm Jessica from IHLA. Here is an email address in case you want to reach out for any potential opportunities. So thank y'all for listening to the rundown. I am going to pass it off to Janet in order to start the talk today.
Great. Thank you, Jessica. And I'm going to go ahead and screen share. All right. Well, I'm glad to be here. And I'm here today to talk to you about People and Pets Project and our application of Clinical One Health. And I have to tell you, I've done a lot of talks, and it's really kind of nice that I don't have to spend the first part of my talk explaining One Health, so I can just jump right in. So our vision as an organization is really we want to create a world where the health of people is optimized through the relationship between the environment and the animals that we all share, and bringing that to the forefront when we approach health. So how did we start? Well, I started the organization back in 2018. I learned about One Health because, like Jessica, I'm a graduate of UC Davis. I did my nurse practitioner physician assistant training there. And UC Davis has 7 student-run clinics, and I would go to get more clinical experience at those. And one of those clinics I spent the most time at was Clinica Tepate, and they opened up Knights Landing, their sister clinic, which focused on rural agricultural workers in Knights Landing, which is outside of Davis, California. And I was there when they talked about One Health, and the UC Davis Veterinary School van showed up. And I thought, this is so cool, because I've always been a huge animal advocate, done a lot of work on the nonprofit side of animal stuff. And I can combine my skill set with my passion, and I want to do this someday, not knowing where the future was going to take me. Because first I had to graduate and learn how to be a nurse practitioner. But I kept that in the back of my head. And then in 2014, I went down to Guatemala. I graduated in 2012. So in 2014, I went to Guatemala and lived there for a month to try to learn Spanish. And I have to tell you, I'm still trying to learn. But I worked with, up in Shela, Papu, which offered Spanish lessons in the afternoon, but in the morning we did clinical work in their clinic. And then we went out to a village for a couple days with the Timmy Foundation. And as we drove into that village, I saw so many stray dogs. And I thought, we need to have a One Health approach to this, because we give albendazole to people every year for parasites, yet they have these dogs in their village. They don't understand washing their vegetables, the whole thing. And I thought, we've got to do One Health. So I kept that on my mind. And then in 2018, I thought, I'm just going to start an organization. And I didn't know at that time that A, we'd be moving to Georgia, and B, that there'd be a pandemic. So in 2019, we did 2 pop-up clinics with a homeless youth center, where we offered veterinary care combined with care for themselves. And then we did 1 clinic in Guatemala. Then I moved to Georgia, not knowing what was going to happen. I talked to the board about it. They said, go for it. Let's see how it goes. The pandemic hit, and somehow the organization really took off here in Georgia. And now we call Georgia home. Here we are. So that's how we came about. What we do in our organization is we've created and we implement community programs, of course, in the spirit of the One Health Initiative. And we really focus on that equal collaboration. We want everybody at the table to feel like they're valued players and they all contribute equally. Because it always seems like, one discipline doesn't get as much attention as the other. We do put a lot of emphasis on public health, because that's really what we're about, is public health. We offer One Health pop-up clinics. And they're sort of like a health fair, and so many health fairs often offer like a free gift card to do blood pressure screening. But what we do is we offer free veterinary care. We vaccinate, wellness, and microchip. But before they get to see the veterinarian, they have to stop and get their health screenings and also talk about preventative health care. Our biggest stress on the healthcare system in this country, well, actually worldwide, WHO announced it, is cardiovascular disease. And so much of that could be prevented. And that, the biggest culprits are hypertension, high cholesterol, obesity, and diabetes. And so many times those diseases are preventable. And even if you do develop hypertension, we have medication that can get it under better control. So that's what we aim to do, is get out there. Now, I said we offer equal collaboration, and the environment's hard to weave in, because when I started the organization, trying to explain to people One Health, it's really hard to come up with an elevator speech. And I knew I was in trouble when one woman told me, "You mean when I get my pap smear, my dog will be spayed on the table next to me?" And I thought, oh gosh, I've really got to figure out, how do I deliver this? A friend of mine said, "Why don't you say healthcare for both ends of the leash? You see both ends of the leash a lot." And I thought, you know what, that's great. And over time, and of course, One Health now, it's come a long way. I mean, the Pope just announced it. So it's definitely more people are more aware of it. We are incorporating more environmental stuff into our programs, because we recognize that that's important too. We have people that we work with at our pop-up clinics, true collaboration style. We are in Macon, and of course, we're home to Mercer University School of Medicine. We also have their College of Health Professions. That's their public health program, is located there. We also have students from UGA Veterinary School work with us. I really want to give a shout out to Paws Humane in Columbus. Without them, we would have failed. We did not have a veterinarian of record when we started. We were partnering with one organization, and it didn't work out. And Paws came in and said, "You can order your supplies through us." And their lead veterinarian, has done so many clinics with us, and it's because of them that we were able to continue. So I'm very grateful. We started with pop-up clinics in the park with Macon Mental Health Matters, and we grew so much that we had to create our own, and we held a lot of our clinics are at Macon Habitat for Humanity. But I'm so excited because this year we are now at 6 Department of Health locations throughout Middle Georgia. And being at the Department of Health is really where we want to be. We want people to come into those buildings. We can also offer more surgeries, listen to me, more than just screenings. The clinic in Houston County, 4 people got their flu shot. They registered someone in their cardiovascular risk reduction program. We had a woman who was set up for a well women visit because she was overdue. We can do more and more at the Department of Health. And then people also know about public health and what's available to them in the community. As I mentioned, these are the services we as an organization offer. We do blood pressure screening. We talk to them about where to get care. If you have insurance, where are you getting your care? If you don't know, this is where you can go. We have one volunteer clinic that they can go to if they qualify. We also spend a lot of time with patient education, to start saying, you don't have to have high blood pressure. Here are some things that you can do. Then for the pets, we do the wellness check, vaccines. Rabies is the big one, as you all know, the zoonotic transfer, and then microchip. And we also offer flea and tick medication. I want to put this up here because when I present to other organizations, I found this so fascinating, and I looked to find a study about this, and I was hoping our student cohort would look at this, and they're not going to, but I'll get someone to do this, or maybe one of you are interested. But if you look at the hypertension map and the heartworm map, they are very similar. And when I went to Paws Humane one day, I glanced on the wall and I go, "Why do they have a hypertension map here?" I was like, "Oh, it's the heartworm map." And one of our board members, who's a veterinarian, went in to see her physician. She goes, "Why do they have the heartworm map here?" So whatever world you're in, you see that, so is the map similar because of access to care, financial understanding of healthcare? I used to think heartworm, oh, it's mosquitoes, and those are only the southeast. And we know that the vectors are changing due to climate change. But still, both of these are preventable. We have medication for both. The map shouldn't look like that. So I thought that was interesting. It also explains why it's so important that we can attack those issues together. So why does this approach work? Well, I think it's effective community outreach. It's a great way to be in the community. Everybody, if they have pets, some people don't like animals, don't have them, but the people that do, having their pet with them, it makes it we're very approachable. Like they want to engage more because their pet is there. And I learned that in my own practice. When I had patients that I had a hard time connecting with, I would ask if they had a pet. And if they did, it really opened up when I started talking about mine, and they felt more comfortable sharing what they what they needed at their appointment with me. Also, pets are great health partners, especially people like, you need to walk more. I'm sure your dog would like that. So this approach really, really helps on both sides. One of the things our organization focuses on is training the next generation. And this is a picture of one of our board members who works with the medical students. We have a cohort of students now every year. We started that 3 years ago. So the first cohort came together, and what they do is they do our pop-up clinics, and then they have to do a journaled article or do a research project that we really want to lead them to publication. So the first cohort worked with Mercer medical students. We did a journal article with UC Davis School of Veterinary Medicine, and it published in the Journal of Community Health and Primary Care. The veterinary community understands One Health a lot more than the human medical community. So my focus is to get information into the human journals. And I noticed the Journal of Community Health and Primary Care is publishing more on One Health. They've gotten an interest in it. So they did publish our article, which I'll put on Circle now that I know about that, showing that this model works, what people think about it. This cohort after them is between Mercer University, and we had a student from UGA Veterinary School, and they're publishing on vaccine hesitancy. They should be ready to submit in the next month or two. So fingers crossed they get published soon on that. And it's very, very interesting what we're finding out with that. And our newest cohort is just starting here. And that will be between Mercer School of Public Health, or health professions where public health is, along with UGA, Mercer Medical School, and then Dr. Lauren Ward is leading this project from University of Michigan. So there'll be 4 universities, and she's our speaker next month. So so we're very lucky to have her on our board. Just as an aside, she is also doing a research project for us in Guatemala that we're spearheading, built between University of Michigan and University of Guatemala. And that's looking at the environmental impacts of mental health down there. And she did the clinical assessment at our last Guatemala clinic. So we're going to continue on that research. So we really want the students to have this experience where they spend like a year with us doing these clinics, doing a research project. So they really dive deep and they know about this approach, and then they can go forward. And the students, especially the medical students, this is their DISC project. So for them, they can put this on their application for residency. So this is something that a lot of the students want because it just ups your chances for the residency that you want. This is our local impact today. We started off with 10 clinics a year. We're down to 8 now. It'll probably go down to probably 5 or 6 next year, and I'll explain why in a little bit. But to date, we've done over 1,000 human health screenings, and veterinary wellness, you can see well over 1,000. We launched our spay-neuter program last year. We were doing mass-style spay-neuter surgeries at Habitat for Humanity, but we will be changing that because we now have a building, which I'll talk about in a minute. Spay-neuter is so necessary here in Middle Georgia. There is no humane society. There's a small one in Warner Robins, but we don't have like an Atlanta Humane or Athens Humane or Thomasville Humane. Yet we're the 3rd largest city, and we're right in the middle of the state. So spay-neuter is something that we need. Also, it will allow us an opportunity to get more veterinary students involved with externships or clinical skills that they can practice with us. These are just a couple of photos of our clinic, so you can see kind of what they look like. You can see the woman there getting her blood pressure taken with her dog, people kindly waiting to be seen. That right there is our mass-style spay-neuter surgery. Yes, on the tables. It was a lot of work, but well worth it. So what else do? We do these pop-up clinics, but we have a couple other programs. The kitten was one of my foster kittens last year that actually, he looks sick here, but he got better and he's living in a great home. When I moved here, as I mentioned, I drove cross country in 2019, just in time to be in Macon for the pandemic. So I didn't have my license yet. My husband was on base working 20 hours a day doing COVID response for them. And I was like, what can I do? And I found out the spay neuter van was actually open. And I knew there was a street here in Macon that had so many cats. I started trapping. And that's how we created our Mousers in the Middle program. And that is a TNVR program, which really is One Health, right? Because they're an invasive species. You know the drill. To date, we've only done 636 cats. That's going to greatly increase with our permanent clinic. I now have several community trappers that I've networked with that we can continually get them in there. Um, I hope we can take it down a notch. I have to say, living in Macon, we don't have a rodent problem because we have so many cats, but I hate to think of what's happening to the songbirds. The other program, as I mentioned, is Guatemala One Health International. We go once a year down there. This is the team from the last clinic. We had people from New Mexico, California, Georgia, Michigan, and there was one other state, I think it was Florida. They all came together and we had a wonderful week. People come in and they drop off their cat or their dog for spay neuter. And then we do actually deliver primary care at that clinic with our providers. Our students met with us last year, which kind of rounded out their experience so they could get the international flavor. And it was just a fantastic experience. And anyone who's interested, we're going again this June. And we would love to have anybody join us. It's just a week, but we have 3 full days of clinic and it's a great, great experience. And I love the country. I went there once, never knowing I'd be going every year, at least once a year, continually. So the next thing I thought, here we are doing these mass style clinics. We're really growing. We're getting more involvement. We need a building where we can actually have volunteers. And I came up with this idea of establishing a One Health Education Research Center. And it's really, I should say, clinical One Health, because that's our focus. And so I thought, I just put it out to the world and we now have a building. We want to start really having a centralized location where people can come to drop off their animal for spay neuter, because we are having a spay neuter clinic as part of the building. And we have a room dedicated for human health care and would love to have provider there either through volunteer bank, Serve Georgia, or through one of the FQHCs where when they drop off their animal, they can be rescreened. We can talk to them again about their healthcare needs, and in a perfect world, we would offer vaccines, but that's down the road. But the idea is anybody who's practiced, especially in primary care, you have to see people continually to keep them up with their health. So this is another way to reach out to people. And for Middle Georgia, we really need to have veterinarians. We have a grain of that profession, and we need more people to make Middle Georgia their home. And it's a hard sell for these young kids coming out of UGA because they all want to be around Atlanta. But they also really haven't had anything, especially if they're interested in shelter medicine. There hasn't really been an opportunity in Middle Georgia for them to practice. So that's our goal. We also, because we haven't had any animal advocacy in the in this area, we want to start building up programs for that, about how to be good to the environment, how to be good to animals. And we just want to create community opportunities for health. This is our building. This is what it looks like. We're in the middle of tenant improvements. We did find asbestos in the floor, so we just finished remediation. I know, we just finished remediation, so we're good to go. Our first set of surgeries is scheduled for March 27th. We are not in the position to hire a full-time veterinarian yet or full-time staff. So it's going to be, I'm hoping 1 to 4 clinics a month. And what we do at our pop-up clinics is, after they go through that, they can sign up for spay neuter that day. And it's $25 for a cat, $35 for a dog. They pay that day and then they get their appointment. And that's, like I said, that's another reason to see them. And then I have our community trappers where we always have availability for them to bring trapped cats in. So our constant goal whenever we create our programs or when we do our work is that we want people that we work with to feel empowered. We don't want to tell them what to do. What we want to do is empower them so they take better care of themselves. And the reason for that is they'll take better care of their animals. But even more important is they'll take better care of the community. When you feel good, you're going to do more. And that just kind of is like a light that shines out to everybody in the community. And that's, I think, what we need. And animals are such a part of that because they offer connection. So it's that full circle of One Health. And that's what we do. And this is the end. I had to share this picture because this little girl at our clinic at Houston County, she came up to me and tapped me on the shoulder, and her mom goes, "Oh, she drew a thank you card for you." And I opened it, and I swear I had tears in my eyes because that clinic, we saw about 90 people and 111 dogs and cats. It was beyond busy. And I just turned around, and that meant the world to me. And that those days where I'm like, why did I start this? What am I doing? It would be so much easier to write a check. This makes it all worth it. So I'll stop here. And if there are any questions, I'd be happy to answer them.